Hi, and welcome to the podcast. My name is Carrie Hyde, and I am the host of the Spawdcast. And with me today is Dr. Cannizzaro. Dr. Cannizzaro, hi.
Hello, Carrie. Thank you so much for having me back. It's such an absolute pleasure and an honor.
I'm jumping right into this because normally I do a whole lot of befores and pleasantries and all that, but we got to get deep into this. So we don't have a lot of time, and I know you're a very, very, very busy veterinarian, so I want to jump into it. But for our listeners, Dr. Cannizzaro has been on our show before and has been so wonderful with her time to help educate you. But one of the things she is the most passionate about, at least from my learning with her and listening to her, is she's very interested in homeopathy. So I want to encourage you, if you haven't, if you listen to the episode that was aired right before this with Dr. Richard Pitcairn, he gets into the history of homeopathy. So he explains a lot about how homeopathy came about. He talks about the father of homeopathy. Now I call Dr. Pitcairn the modern day father of homeopathy. But we knew there was so much more that we could probably do 50 episodes on this. So I thought it was really important to bring on some more homeopathic veterinarians, and I couldn't think of anyone better than Dr. Cannizzaro to come on and help us understand a little bit more depth. And it's so hard for someone like me. As the listeners know, I am just in my infancy of learning about homeopathy. So I'm learning with you, and I'm very excited. So Dr. Cannizzaro, can you tell us, I know we've talked about this before with other vets, and I mentioned it with Dr. Pitcairn, that you're not taught this in veterinary school. There isn't a veterinary school that you can go to. So tell us a little bit about how you got into this from veterinary school.
You're absolutely correct. It isn't taught in veterinary schools. Some of the veterinary schools are open to bringing in some alternative practitioners, homeopathic vets, but homeopathic medicine, because it is so opposite of allopathic or traditional medicine, it doesn't garnish as much interest with the big schools because of the stronghold of big pharma, which of course I call big pharma. And when early on getting out of veterinary school, I had an interesting experience. Actually, my first job out of veterinary school was a small animal practice, and the gentleman that owned it was kind of an absentee owner, but I learned a lot from the technicians and such, but somehow, and it's funny how subconsciousness works or something, the staff would sometimes put these natural magazines on my desk, and I didn't know why, and they would also give me a very and sundry clients that they didn't want to deal with. And one of the clients that they handed me one time was a woman who had a very ill cat. And she came in and she was waving Dr. Richard Pitcairn's book, Natural Health for Dogs and Cats. And she stared me down and said, "Do you know about this book?" And she's waving it at me. And I said, "No, I don't. It looks interesting, but no, I don't know." "Well, you should know about it." And I just thought, well, okay. And anyway, long story short, her cat was in grave condition. I did take her cat in. She handed me a couple vials of homeopathic medicine, which I know now she wasn't using appropriately, but she was also not working with a homeopath. And I'd like your listeners to know that's a really, really good idea to find a qualified veterinary homeopath, especially if your pet is gravely ill or has chronic diseases. And Dr. Pitcairn referred to that in the previous podcast. So I'll go over it more if the difference between acute and chronic, if you'd like to. So anyway, I took the cat in and she said, "You have to give these medicines." And I said, "Well, I don't know what they are, but I only know to do what I can do." And she said, "Well, you have to use these medicines." And I thought, well, as long as they don't cause any harm, I have no problem doing that. And that's unusual for an allopathic veterinarian to say. I did use them. They didn't help, but they weren't being used properly anyway. So that was sort of my first little introduction. And then later on, a friend of mine told me about Dr. Richard Pitcairn's homeopathic course for veterinarians. And I looked into it. I had already completed the acupuncture course, and I felt rather satisfied with that, but I still felt like there were pieces missing. Because early on in my career, I recognized that the cases that I was treating kept coming in over and over again with the same problems, the same chronic ear infections, the same dental issues, the same gastrointestinal issues, the same skin issues. And I treated them exactly as I was taught in veterinary school, And, they'd get better, but then the medicines would wear off, or as we know now, suppress the patient. And then the symptoms would come back, sometimes even worse than they were before. And I would go back to using the same old medicine again. And if anybody's familiar with the adage, doing the same thing over and over again and expecting a different outcome, that's what I felt like I was doing. And I thought there must be something else here. And then my colleagues would tell me, well, it's just because the clients are not using the ear medicine as directed. And didn't you see the client admitted they forgot 2 doses? And I said, well, so what? So what if you forget 2 doses? If we're on the right medication and it's treating the source, then the patient should get better and we shouldn't see this problem again. So that was my search for alternatives, because I knew that there had to be an underlying reason that these animals would come back with the same problem, asthma, whatever it is, over and over. And I didn't feel like I was doing the service. And I also noticed that the animals were not getting healthier. They were getting sicker, and they needed more medications and more frequent medications. And then they got more diseases, and then they got cancer. And I thought, well, it shouldn't go this way. I mean, if I took an oath, above all, do no harm. And I thought, I keep doing all these things that I know these medications have side effects. And I thought, I just don't, they should be getting better and more vital. And if these prescription diets are so healthy, they should be getting better and well. If the diets that we recommended, for which we had no idea what we were recommending, more or less, sorry to say, if they were so great, then why weren't the pets getting better? So that was my journey to holistic medicine. And I ended up with homeopathic medicine. After taking Dr. Pitcairn's course, I really felt like I had come home. And it really resonated with me. The first part of it, I was terrified, because I had to give up everything that I was taught in veterinary school except for my problem-solving skills. And I thought, oh my God. And I don't even begin to tell you how much money I spent to go to veterinary school and undergraduate, but suffice to say that my student loans were bigger than house payments. So it was devastating. And then, of course, I had to spend all the extra money to do all the holistic all the holistic training that I had. So I really felt like I had come home. And once I could let go of the fear of realizing that what I was taught in veterinary school about diseases was just really not accurate, and understood that for me to embrace a new way of thinking, it has to make sense to me. And I used to work in research, so I was pretty logical, and my brain was pretty logical. So for me, it had to make sense. And this made an awful lot of sense to me. So that is how I got involved. And then I did go on and do the professional, I did both of his courses, Dr. Pitcairn's courses, and then have taken some training from some human homeopaths as well. So I love homeopathy, and we're gonna delve into why. And I hope your listeners are going to embrace it and love it also. And I hope you will as well, Carrie.
I already am. I don't remember who I was telling, but and hopefully my husband will never listen to this because I tricked him. But okay, if my husband is listening to this, I love you very much. But
he does, I swear.
And
maybe you can keep the kittens too.
No.
Okay, never mind. Sorry.
I don't know, maybe, but I tried something that was a homeopathic for him, and I didn't tell him that's what it was. And because it's harder, especially for him, because he's not in this world that I'm in every day. And going back, as you were talking about when you were a veterinarian and you see the same problems over and over and you keep treating and you can't. Now, I was never a veterinarian and I am not one now, but I was a vet tech for 12 years. And I can tell you it was so heartbreaking to see the same problem over and over and over and nothing ever getting better. And this, we'll try this antibiotic and we'll try, but there was like 3 antibiotics that they used, and they would just go from Clavamox to amoxicillin and, on and on and on. It went on and nothing ever got resolved. And most people know the story of why I left. That is part of it. It was very frustrating, but I worried so much about the burnout from veterinarians because of it, because think about that. If you're the vet tech, then it's like, well, I'm not the one in charge. But if you're the veterinarian and you're just spinning your wheels, eventually you're going to get burnt out. And then
it's very difficult. And I know allopathic colleagues. And again, allopathic refers to traditional medicine. I don't like to use the word traditional medicine because it makes it sort of sound as if it's superior or should be the first or primary medicine. So
That's a good
allopathic
point.
medicine and homeopathic medicine puts them on equal playing field, if you want to look at it that way. Burnout is very challenging. I mean, I can tell you in the short period of time, in the first 5 years, or maybe it was more than that, that I was doing mostly allopathic medicine in my career. I mean, clients would get angry with me and say, well, I was
Sure.
in here, a month ago with the ear infection, and now you want me to come in again and I have to buy more of this medicine. Why don't you just refill it? Well, the
Yep.
medicines have potentially dangerous side effects, so it's really not a good idea. So I want to put a plug to my allopathic colleagues that are telling me to
Sure.
please come in again. We need to reassess the patient, even though our medicine is inferior and doesn't work. And maybe, just maybe, the veterinarian might come up with something else. I mean, I'm not sure, because the allopathic veterinarians understand that it's an incredibly limited apothecary. So I have a joke about allopathic medicine. If we take steroids and antibiotics away, veterinarians don't know what to treat with. That's true of human medicine as well.
It is
And
true.
it's a sad fact, because they are the two most dominant medications. I mean, I won't touch that we now have Apoquel and Cytopoint, which are equally or more dangerous than the aforementioned. It is tough, and I feel sorry for my allopathic colleagues, because we
I do
don't
too.
training. And so this is all they have to offer. And when clients come in to see me, I always tell them, please, they'll come in and be angry about the allopathic veterinarian. Well, I went 17 times for this ear infection, and I've spent all this money. Well, yes, you did. And I absolutely empathize with that.
Absolutely.
But I tell them, they're like, well, why didn't they do what you suggested? And I said,
I hear that too.
they don't know any better. What I do fault my allopathic colleagues for is to get educated, refer to a homeopath. Don't be so pride-filled that you want to bash or don't believe in, or, so reach out to a holistic colleague, particularly a homeopathic veterinarian. We're here to be helpful. And I do work side by side, sort of, with allopathic veterinarians, because I have clients that are far from me, and they can't just pop on over here if they have a problem to have it checked out. They need a local veterinarian to work with them, and we'll delve into that a little bit more as we go along with Carrie. And we need those veterinarians, and we need them on board. I need their eyes. I need their sense of smell, their interpretations, their diagnostic tests. I need those things, and we need to be able to work together. And so there's no excuse. If I am going to discuss the possibility of chemotherapy with a client, which I don't do and I don't believe in and I'm not comfortable with, it's my obligation as a veterinarian to discuss all of your options. I think on the flip side of it, if you don't know anything about homeopathy, you can at least say, I don't know anything about it, but maybe that would help.
Yeah.
Be open-minded. And that's a word, I want your listeners to understand that and have a little bit of empathy toward the veterinarians, but maybe not a ton if they're not going to refer out.
Well, that's one of the things that you're touching on that is so important to me when people listen to the episodes that I put on here. I refuse to be a podcaster who only gives you my one viewpoint, because to me, I don't think, and I know, I've never asked you this question, but I'm sure I know the answer. There isn't one thing for every single pet. So if I get closed-minded and I say, for example, all dogs should eat a meat-only based diet, I could be really hurting and harming animals, because not all animals can do that. And some will. I'm not a supporter of all meat diets, but some people have said, and there's going to be thousands of people out there who say that's all my dog ever ate and he did fine on it. And that may be true, but I can find equal amounts. And that's why I bring on people who talk about stuff. I don't even know anything really about homeopathy, but I'm so excited to learn, because both you and Dr. Pekarin you mentioned how, you're a logical person. People want to paint this picture of people who are into homeopathy as these crazy witches who are, stirring pots of weird stuff. And I'm here to tell you, these are two of the smartest people that I know. And they're here to tell you that there's another way. It's a very, very successful way. So before we get into that, because I want you to share a story with me, so keep that in the back of your mind. But before we do, I want to go back to something you touched on about the pharmaceuticals, because a lot of times people say, well, if it worked, the pharmaceuticals would get involved with it and then they would sell it and then they would make money. So I know why, just from the little studying I've done in homeopathy, but tell me why that can't happen. Why wouldn't pharmaceuticals just go, okay, well, we're just going to sell pot to everybody. Not that pot is a homeopathy thing, but you know what the point I'm trying to make here. So why do you think that is?
They cannot patent them. They can't patent natural products. They're able to patent synthetic and synthetically derived and manufactured products, but homeopathic medicine, nutraceuticals, vitamins, herbs, they can't really be patented. And however, I do want your listeners to know that the homeopathic medicines are regulated by the FDA. So these are not like little woo-woo pellets, that are, just silly nonsense little things. And I do want you to refer your listeners back to Dr. Pitcairn, because in the discussion about history, I want you to understand that homeopathic medicine was very popular in the United States at one time, but now it's been squashed down to nothing. And I'll leave the previous podcast to share more about that. It's incredibly sad. But if they could patent homeopathic medicine, they might even embrace it if they could patent it. But if they can't control it and they can't patent it, then it's no good and it doesn't work for anything, and it needs to be tossed out or considered, ridiculous and witch medicine. Additionally, the thing that is very difficult and creates such a problem in allopathic medicine about homeopathy is that most of the potencies we use don't even have any actual physical substance in them anymore. They're energetic medicines, and therefore they freak people out. So a more dilute medicine being stronger is completely opposite of having a stronger pill of Tylenol that has more milligrams of drug in it, for instance. In which case, homeopathic medicine, it's the opposite. The less noticeable substance or measurable substance, the more powerful or stronger the medicine is. So that's really difficult for people to wrap their head around. And I think, too, pharmaceutical companies are like, well, that's just not possible. And yet every day we see it. And I want to say clearly that when we are treating animals in particular, there is no suggestibility. They either get better or they don't get better. You might argue that people will have suggestibility.
Right.
Oh, yes, no, I feel better. I mean, I guess you could measure their blood tests and see if they're better or not. But that said, we have to rely on the patient and how the patient acts, feels, and is in order to determine whether they're truly improving. And animals are not suggestible. They're just not.
I say that all the time with acupuncture, when people poo-poo this or, that's just, I don't believe in that stuff. And I say, well, the dog wasn't walking and now he's walking. So I don't think that he would just, had a better day today. It's not, there's no placebo. There's no
way we can have any consistent placebo effect.
Right.
In animals. I mean, they get better or they don't. And if the tumors are shrinking after a homeopathic medicine, they're shrinking. It didn't just happen by accident or, the client, changed to, it is good to change to a whole foods diet, don't get me wrong, but changing to a whole foods diet will sometimes positively affect tumors. It does assist and it does help. I know in human medicine for macrobiotic eating, there are true cases of remission or complete cure of cancers with diet alone, but I can't say what else they might be doing. So I know there are some cases where they were not doing anything else. But again, I can't give you, they're not double-blind studies, I'll tell you that. But if people say that this is what happened and they're now considered cancer-free, they're cancer-free. I mean, they are not spontaneous remissions. That doesn't happen. Something happens to create remission of a disease process.
Yeah, I think that's the hardest part from a holistic standpoint. I'm not that well versed in homeopathy, but from a holistic standpoint, I have heard many, many, many times from veterinarians, well, that's just a coincidence. To the point where I had a client years ago whose dog was having seizures. Mm-hmm. To the point where she was wearing a seizure bell. I've talked about her on the story a lot because she was one of my beginning stories. We all have them where you're like, wait a second. Well, he had this dog on a lot of medications for the seizures and they weren't working. The dog was a vegetable sitting in the corner at this point. And so I had suggested she stop taking the flea and tick medication that the dog was on.
Oh, my.
Yeah. Surprising that the neurologist never suggested it to her at all.
Wow. That's a big problem in our profession. It's a huge problem. And, it's one
not to harp on that, but
yeah,
on the flea and tick stuff, but really quick, since I did bring it up, I think the problem is when a veterinarian sells you something and it has the potential and it starts, they're going to have a hard time coming back and go, oops, I'm sorry, I didn't know. I wish they did, but they didn't. And so a lot of times when veterinarians are saying, oh, no, that's not the problem, it's because they sold it to you. They can't very well go back and say, but my point on those seizures was that they slowly started to go away. They went from being less violent to less frequent to eventually going away. So she went back to the neurologist, which she only saw every 6 months. And she mentioned it to him. And his response was, well, the medications just started working. I'm sorry. This dog had been on medications for a year.
I'll tell you the other thing we hear. I've had cases where ultrasounds have diagnosed a tumor in the abdomen, let's say, and I've treated the patient with homeopathic medicine, and the tumor shrinks and actually, goes away. And then they go back for the follow-up ultrasound, and there isn't a tumor there anymore. And the internist says, oh, it must have been a misdiagnosis.
Oh, yeah, I've heard that one.
What's the other one? Yeah,
I've heard that one.
Are you serious?
Yeah.
And you want to put yourself in that light that you misdiagnosed someone's pet as having a tumor in the abdomen, a probable cancer, and it must have been a misdiagnosis.
Instead of saying that homeopathy worked.
Right. It was exactly that important to declare that a misdiagnosis than to admit that something else might have actually worked.
Yeah, that's heartbreaking.
It is.
So before we go too much, we're going to go into the homeopathy. Can you had mentioned explaining acute and chronic. So before we get into this, so we can make sure we're clear on what we're talking about.
What I'm going to do is I'm going to talk about 3 major things, because often if I don't make this kind of clarity, then it's going to be more confusing to clients. We have true acute diseases, and examples of that is a bee sting or a fracture. Those are acute, injuries of some kind. Another acute injury could be food poisoning, for example. That would be an acute. That would be a true acute. The other thing we see is what I call acute flare-up of chronic disease. That means that the patient has a chronic digestive issue, maybe like recurrent pancreatitis. They have quiescent periods where things aren't so bad. And then they have a crisis where they're vomiting and can't hold food down and have abdominal pain. They present to the emergency clinic, and it's kind of considered an acute because the animal was suddenly throwing up, but they have a history of digestive ailments. So this is an acute flare-up of their chronic disease. So too could be said of skin problems, etc. So if you have a skin problem and they haven't had a skin problem for 6 months, a year, 3 years, and it comes up again, it could be acute flare-up of the chronic disease. And then we have true chronic diseases, which are the ones that a lot of people are familiar with chronic arthritis, chronic inflammatory bowel disease. So the animal is afflicted with symptoms more or less all of the time. And it's been going on for a prolonged period of time. Or it is a problem that it goes on to a greater or lesser degree for a long time, but they might be better and worse, over back and forth over periods of time, whatever the ailment might be, whether it's a skin problem, digestive problem, pancreatitis, arthritis, limping lameness problems, and even seizures. So by nature, we could say that most all of those problems are going to be chronic problems. But it doesn't mean the animal is having a seizure all the time, but they might have a blow through of a seizure or breakthrough of a seizure through the medication, for example. And then again, it's truly important to evaluate, are they on the flea and tick medications? Because that can cause seizures. And every veterinarian and every neurologist and every specialist should know that.
Yeah, I think it used to be that I would say, your vet just doesn't know. There's not enough research to make them believe that the flea and tick stuff is causing seizures. That's not the case anymore. The FDA has even reported it. So now
you can read the drug inserts.
Yeah. Oh, I used to have the drug inserts up at my work so people could read them. But it just it's not the case anymore. I'm sorry if your veterinarian is still selling you flea and tick medication like it should be drenched on your dog every month. You need to find a new vet. That's just where I am with it. I'm just,
Yeah, please.
I hate, people, I defend veterinarians a lot, but in that one case, I just can't do it. Now, that being said, I have had a few really, really bad cases. I had a cat one time, and it just, every time it came in, it was infested to the point where the cat was getting anemic and the guy couldn't control it and whatever was going on. And
that's a chronic disease problem, by the way.
It was just,
so it's a chronic disease problem.
It was just horrific, this poor animal. And so it got to a point where I told him, you may have to give him some of this stuff. But even then I told him, you don't have to give the whole thing. Let's see if a little teeny tiny bit of it's going to work. You don't have to cram it down his throat and give all of him. And he ended up giving this cat, it happened to be Comfortis. I am not supporting Comfortis right now. I'm just saying it happened to be Comfortis. He gave the cat a little quarter of it, and it completely worked. And then we got him on a more regular basis, and we were able to get him under control. So, but again, it's not a plug for that. I'm just saying, if you're going to use that stuff, can you please not use all of it? And preferably don't use any of it.
Go find a good homeopathic veterinarian.
Yeah. So that the fleas don't want to be on your cat.
Right. Well, but the other thing is that even a tremendous amount of fleas should not in any circumstance cause anemia. And when it does, then you have a serious chronic disease problem where the animal is so weak, they're attracting a lot of fleas, and they are also so weak that they also get anemia. And so that's serious. So using those medications could be potentially even more dangerous. So at least a tiny, tiny amount, better than nothing.
It went on I was dealing with the cat for 6 months. So, and it would come in every month, and its gums were pale, and I would tell him to go back to the vet. And it was just a sad case, but it ended up resolving quite well. Thank God.
I'm glad that it resolved without, too much negative intervention. So good on you for being able to kind of get on top of it, and the owner to do so as well in the capacity you could. And that's the point, with allopathic medicine, there's so many limitations. So many. With homeopathy, it stimulates a healing response. So there's no side effects.
That's what I love about it.
Interactions. It either works or it doesn't. If it's a partial fit, the patient might get a little bit better, or certain symptoms might get better and certain might not. But it is a slow progressive healing in chronic cases. In true acute disease cases, the treatment can be very rapid. I was bitten by a cat one time. I'm pretty clever about that. Doesn't happen very often, but you know what? It can happen. And I took homeopathic Leadum, and the pain went away like within a couple seconds. Yeah. And it got infected.
It's amazing.
Need antibiotics. And I might have had to repeat the dose maybe one time. That was it. So I'm not saying that is the homeopathic medicine for every single body. It is a common one, I'll tell you that. But there's nothing.
What is it called?
Leadum. Leadum. Right. And it's great for bites.
Because
everyone, but
I'm not as quick as you apparently.
You're probably even doing more handling, grooming and bathing, and I'm doing things they don't particularly care for either if I'm drawing blood or doing something like that. So there are times when they don't think I'm the best person in the room either. But it can happen. And when they get stressed out, I mean, that's their natural instincts to lash out. So I get it. You just try to be incredibly fast. I hope as I age, I will maintain that speed.
I hope I need to gain this speed, although I do a lot of cat baths. So I'm walking right into it. It's my own fault, I suppose. The worst dog bite I ever got was from a Labrador retriever, taking blood from him. And I was actually taking the blood, and the person that was holding didn't do a very good job. And it was the worst bite I ever got. I still have a scar on my hand to this day. I wish I would have known about homeopathy then.
Oh yeah, it's invaluable. It just is. And there really isn't anything that homeopathic medicine can't treat.
That's what Dr. Pitcairn said. He said there isn't, because in that previous podcast, I had mentioned, is there something that homeopathy wouldn't work for? And he said, no, it's just making sure that you have the right and you understand how to use it. And that is where I want to kind of go into this next few questions is, before we do, there's a lot of confusion. people think if they go to a holistic veterinarian, they have a homeopathic veterinarian.
Whew.
Now, I think you can't, correct me if I'm wrong, I'm sure you will. You can have a holistic veterinarian who's not a homeopathic, but you're not going to have a homeopathic that's not holistic. Correct?
I would agree generally speaking, I would agree with that statement. But I would have to qualify that there are some individuals that consider themselves homeopathic practitioners, and they're using combination homeopathic medicines, which is not homeopathy. So a person does have to be careful that they truly understand what they're walking into. There's an umbrella of holistic modalities. So holistic medicine is a huge umbrella. And what that umbrella does is it covers all holistic modalities from massage, excuse me, to Reiki, to acupressure, acupuncture, Chinese herbal medicine, Ayurvedic medicine, homeopathic medicine, chiropractic or spinal adjustment. So a lot of people confuse, maybe because they're two H words, I don't know. But homeopathic medicine is one form of holistic medicine. But my experience is that the true homeopathic veterinarians who are practicing primarily by Hahnemann principles, these individuals are some of the most holistic veterinarians you will find. In my world and in my vision, a holistic veterinarian should be a veterinarian that's looking at the whole patient, and they are considering every single aspect of the patient mentally, emotionally, and physically, even as we do as a homeopath. But then the method of treatment should be holistic also. It should be natural medicines. And the fact that most, quote, holistic veterinarians, I think you call them holistic, and I love that term. I don't want to bash them. It doesn't mean they're not good veterinarians, but they're allopathic veterinarians that offer some holistic modalities. Yeah. And it is extremely difficult for a homeopathic veterinarian to coexist in an allopathic practice, because the method of thinking and understanding health and disease is so diametrically different that it's extremely different to coexist that way. You can't look at a case with an allopathic mindset and treat homeopathically. It isn't possible, because in allopathic medicine, we're trying to find a dislike medicine, a medicine that would stop diarrhea, for example, instead of a homeopathic medicine that in a healthy individual would actually, if given in enough doses, enough repetition, enough times in the healthiest person, could actually cause diarrhea. So you can't think that same way, because health and disease, if we want to understand that disease comes from an inherent imbalance in the individual, then that the symptom or the diagnosis is not the disease. So hyperthyroidism is not a disease, it's a symptom. And it is a term that we as veterinarians can use amongst ourselves, so we have a collective understanding of, in allopathic terms, what we're saying the pet has symptoms of. But all hyperthyroidism or diabetes or cancer or whatever, all of it is just a symptom of the underlying imbalance of disease in the patient. Therefore, if we don't treat, forgive me, if we don't treat the underlying cause of the symptoms, then we are not going to heal the patient, and we will not be able to cure the patient. It's not possible. So we can't be an allopath and a homeopath in the same practice, because we're not going after the same thing. An allopath is going after squelching symptoms without treating the underlying cause. And the homeopath is searching for the underlying cause that is causing the symptom of diabetes, cancer, seizures, inflammatory bowel disease, allergies, asthma, excuse me, or pancreatitis, or heart disease, or kidney disease, or whatever the case be. Now, we'd rather not get to an ultimate structural disease change. We would rather treat at the functional stage, which is the energetic stage. That's the stage that your listeners all know about. You go to the doctor, you have a collection of symptoms. They can't fit you in a diagnostic allopathic box, so they tell you that it's your imagination, because they can't find anything wrong. Homeopathy takes those symptoms, distills them in an understanding to fit them to a single homeopathic medicine that stimulates healing, that treats the underlying cause, that will resolve the patient's symptom. And you don't have to have positive diagnostic tests or fit in a diagnostic box in order to be treated. And I'm going to tell you, because of our polluted environment, lousy diets, too much flea and tick medication, too many vaccines, genetically modified organism food, chemical preservatives in the food, pesticides, dirty air, dirty water, I don't care, choose whatever. Because of all of that, our cases are now coming in hard to diagnose. We do every test under the sun and we go, I don't know, there's something wrong, and I can see there is, but I don't know what the diagnosis is. Let's go to a specialist where you can spend more money. And then they still can't find anything. So what do? They treat with antibiotics and steroids. Okay. So, and again, that doesn't fix the underlying imbalance. But homeopathy, I like to have a working idea of the dynamics of what's going on in diagnostic tests within reason, not invasive. Don't open them up and search around the abdomen or anything,
Right.
but ultrasounds and blood work and anything that's reasonable that doesn't require anesthesia or surgery or something like that. These are the things that, I like to delve into, because I can have an understanding of the development of the disease process if there is tissue change by that time, whether it's kidney failure, liver disease, fatty liver disease, asthma, whatever the diagnosis, or cancer, tumors, etc. And it also gives us a prognostic idea, a realistic idea of what we may be able to accomplish. And Dr. Pitcairn may have mentioned that if we get to an ultimate stage like that of cancer, that is chronic disease and underlying imbalance that has completely it's a runaway train.
Yeah.
It doesn't mean we can't treat these patients, but we might have to be realistic about perhaps not being able to cure these patients, but we absolutely can make them more comfortable. And I understand if people elect chemotherapy, there are some homeopathic veterinarians who won't take cases where animals have had surgeries and chemotherapy and Cytopoint and Apoquil and all kinds of suppressive drugs, because the cases are harder to treat.
Yeah.
Once you're piled on these drugs that have enormous disease unto themselves. And I'll say again, in the podcast you and I did previously about veterinary induced disease, remember, you have the underlying imbalance that was the original imbalance, and then it's piled on by all the drugs, vaccines, surgeries, chemotherapy, Apoquil, Cytopoint, all that you have loaded onto the pet has now created layers of additional disease onto the patient. And their cases are not clear. They're a little bit difficult to unpack, to peel away and figure out what's going on. They take longer to treat, and the animal's vitality might be principally reduced in such a way that it's hard for them to respond in a healing, curative manner to help rebalance to homeostasis again. Does that make sense?
Yeah, that's why I love having you on the show, because you explain things in such a great way that but you get these holistic veterinarians, the ones I call holistic are the ones who are doing both. They're trying to do both. And
they're creating just about as much harm as an allopathic vet. It's a tiny bit better because they might throw in some herbs or some nutraceuticals, but it's sort of like bringing lighter fluid. What's sort of like bringing a pail of water to a forest fire.
Right.
I mean, if you're going to throw on a little nutraceutical, but let's give that that Cytopoint injection, it's driving with the brakes on. And this is what I tell clients. They say, well, can I do both? And the answer is, well, no, because you're driving with the brakes on. And that's exactly what you're doing, because Cytopoint says don't heal, don't have any inflammation, don't express your symptoms. And I'm using a homeopathic medicine that's stimulating the patient toward healing and homeostasis. And the body goes, woo, I'm not supposed to be doing that. So if you have Cytopoint or prednisone or atopica or Apoquil, and you want to heal a skin problem, and I'm doing homeopathy, and the client says, oh, but they're itching. I know they're itching. And I promise, if this is any solace for your listeners, people say to me all the time, yeah, well, maybe I could just wean it, or I could whatever. And we do need to wean them off medications. Please work with a qualified homeopath to help you with that. But you can't use both. You can't use both because you will be driving with the brakes on. And if I have no symptoms to treat, then I don't, how am I supposed to treat if there are no symptoms present? Additionally, understand that there is no solace in using those medications, because I promise you that the only end point is that eventually the original disease is going to blow through the drug. And no matter how high a dose you use, the animal is still going to be itching and miserable. Then what are you going to do?
Right.
Because they will go there. And if they don't go there, they're going to get cancer or organ disease or something like that. Then what are you going to do? So that's the only path that it goes. So
It's just, they're so scared. We're scared. Pet parents are, I can't wait. I know you can't wait till
be more scared of the drugs and the consequences and the end point of the drugs.
Right.
Don't be more scared of the symptoms the animals are expressing. Remember that when you have a symptom, whether it's a migraine or itching or allergies or whatever it is, we are here. We're licensed veterinarians. We are here to help you through that process and try to limit the discomfort of the patient. But you cannot go to the gym and begin to work out and miss out on the soreness in the beginning.
And eat McDonald's.
And eat McDonald's and get fit and feel good. It can't happen. And if you say, oh my God, I got sore, I'm not going back to the gym again. And then you have a change of heart a week later when you're not sore anymore. You don't get to go back to the gym again and not get sore again. If you don't work through that process, you will not get better and heal. Your muscles will not say, oh, I got this. Okay, I can take care of this. Understand that the body is so mixed up from everything that's been done to it that when we stimulate healing, sometimes it's like a ball in a pinball machine. It's not, the body doesn't go, yeah, I got this. I know exactly what to do. Sometimes it overreacts or bounces around or the symptoms break through or, and we have to walk through that together. This is a partnership. But if you want true healing, we have to go through that process. And not all the processes look ugly. Some of them are beautiful. Some of them will come back and the client says, oh my gosh, the first remedy you gave here, my dog hasn't been itching at all. And look at the code and, they have so much more energy. And I didn't you feel tempted to use an antihistamine or a steroid pill or, I threw them in the garbage. My animal's just great. I've never seen anything like this. And they're so happy. So I hate to give you the worst it could be, but
we need to hear it.
We need to be in this thing together. And you need to know that because we have been trained to get rid of symptoms so fervently, please understand that when your body produces a symptom, it's trying to communicate to you. And if you shut that communication off, you will never get better. Never.
God, that's very profound to say that, to get people to accept the symptoms and be okay with the symptoms until we can heal. Well, not me, because I'm still learning, but and I won't anyway, because I'm not a veterinarian, but I will send you, our listeners, to these fabulous people that come on the show. But that was one of the things Dr. Pitcairn said, is the difference is veterinarians want to, allopathic veterinarians want to suppress, homeopathic want to see the symptoms so that they can, and it makes logical sense. So, and it just does to me. And a lot of times when Lori, who is the person who does some of my background right before this started, we talked about how at the end of each season, I'm going to be doing a wrap up on kind of things that I believe and so that I can kind of help people. And one of the things for me is when I decide to tell somebody to try this or do this, it's because it's just logically made sense to me. When I years ago, I decided to stop selling kibble, and because I came from the background of selling, prescription diets and stuff. So it was a path for me I had to get to. But when I made that decision to stop selling kibble, it just was so logical. It just made sense. How can you get nutrition out of something like that? So homeopathy, the more I dive into it, the more, thanks to you and Dr. Pitcairn and some of the other books that it makes sense to me that you would need to have those symptoms, not just cover them up. And so I love that part of it.
I want to be clear that I don't want your listeners to feel like, oh, if my pet has symptoms, I should just sit back and watch that.
Thank you. That was going to be actually the next thing. We don't want your dog dying in the corner.
Exactly. And we will help you understand what symptoms are more serious and command attention immediately. And if we can't fit you in quickly, we might refer you to your local veterinarian to make sure there's nothing serious going on. So I don't want you to take symptoms lightly. If your pet has recurrent symptoms that keep coming back, no matter what they are, they command attention. If you see a symptom that shows up once and goes away, and I mean, if they have a seizure once, you need to pay attention to that, even if they don't seem to have another one. But you know what I mean? Like if they have a spell of itching and then that just happened once and that was, then it went away and you never saw it again, you don't need to rush out and make a homeopathic appointment. Although I will tell you, and I can't say all my colleagues do it, but I hope they do. We as homeopathic veterinarians should, and in my practice, I encourage this, make a wellness check. If you don't even think your pet has symptoms, make a wellness check with a homeopathic veterinarian. Because if we're a good homeopathic veterinarian, we're going to talk to you about appropriate diet. We're going to look over all the medical records and make sure there's nothing missed. We're going to go over an intake. I go through a systems intake just to make sure that there aren't any chronic disease that the pet has had that I might expect might rear its head again, or at least bring your attention to it. And that way we can get a steady state together and you're already in our system. So when you call up with an emergency, a pancreatitis emergency, or, my pet can't keep food down, it's hard. Initial intake is going to be an hour to an hour and a half. Some veterinarians, it's 2 hours. I usually schedule mine for an hour and a half, usually not less. Sometimes it's more. And it's pretty hard to fit you in for an emergency. I need all the records. Yeah. And all of my colleagues should be doing this. I ask for all the handwritten doctor's notes as far back as you've had your pet for, including any and all test results, x-rays, ultrasound reports, specialist reports, ER visits, whatever. I ask for all of those materials because I need to understand the eyes from a veterinary perspective of what's gone on well before you ever came to see me. I might see your dog at 13 years old. I hope I see them as a, puppy or a kitten or a foal.
Those are the best, because then you can set them up for success. Those are when somebody comes to me for nutrition advice, which I rarely get, and I'm encouraging more of you, if you're listening with those puppies out there or those kittens, to contact me on nutrition, because I love when they come to me before they've been eating kibble for 10 years and before they've been, because I do a little, this is what I would do. This is what I wouldn't do, and I look at all of their flea and tick and stuff. So, but the puppies are the greatest and the kittens are and that's not to say that, obviously we want to help the older dog, but I don't want to see the disease in them.
Well, they need you.
Yeah, no one does. I don't even think an allopathic veterinarian wants to. It's just that it's a different mindset of setting up for success and thinking about, when your dog is 15 years old. And now, even as a homeopath, I would imagine it's very difficult when you have a very old dog who maybe 15, 16, 17, hopefully 18 years old with this disease he's had forever, and they finally get frustrated and then they end up with you. The time that you have we don't have them very long. And so I think the timing is part of it too, whether you can do something for somebody, right?
Is very important. That goes back to the layers on the original disease, the original imbalances. And, once you've done all the surgical removals of the lumps and bumps and warts or mast cell tumors or whatever they are, or, fibrosarcomas, et cetera, those patients and, vaccinated, umpteen years in a row, et cetera, flea and tick medications and various drugs for various ailments. Once we see those, that's a lot of layers to get through, and we only have so much time in the treatment.
It's so much.
Clock back 100%. We're going to work our hardest to try to achieve the highest level of health that patient can achieve, and we have to be realistic about it. And I want to say too that a lot of people, when they go on our websites and they'll see our hourly rate, most homeopathic veterinarians charge by the hour. That's very, very, very common. And actually, it's the fairest way of charging. To be honest with you, I think the allopathic veterinarian should charge by the hour too, because you get, in most cases, and it's not always, in most cases, you get maybe 2 minutes of the veterinarian, and you just paid about $50 to $60 or $80 or more for an exam. To see the vet for 2 minutes. And not very expensive if you want to break down the minute charge. Remember how you're going to have to continue to take your pet back over and over and over again with allopathic medicine. In the long run, you will, and I assure you, spend more money chasing the non-curative treatments over and over again than you're going to spend with a veterinary homeopath. And
Absolutely.
The other thing I want to say, which is something you said earlier in the podcast, is that when someone approaches me and they say, well, maybe there's not one treatment for all animals, I would actually say that homeopathic medicine, in my experience, and I'm trained in other modalities, is the deepest, the most profound healing that occurs in any species, period. Human, animal, doesn't matter what it is. There's nothing homeopathy can't treat. Now, that doesn't mean that we succeed with every case we treat. Sure. But I also want to make it absolutely perfectly clear that when you go to an allopathic veterinarian, there's a whole lot that we treat that we do not cure, like a lot more than what we do. And so when people say, well, it's almost as if they want a homeopath to rise to a higher standard, in the sense of, well, if I'm going to come and see you and do something different, then their expectation is higher. In that case, I need to make sure my animal never throws up again.
Yeah.
Well, would you say that to the allopathic veterinarian, and would you actually even get it? With homeopathy, that might happen, but it also might not happen. It just depends on the dynamic nature of the disease, the compliance of the client. If the client wants to continue to feed kibble, then understand we're somewhat driving with the brakes on. So yeah. I'm not going to tell you can't do that. I'm going to tell you it's not a good idea, and that our expectation for achieving optimal health is not going to be nearly as high. Yeah. So you have to adjust your expectations, and it's frustrating for us because we know that's going to be a barrier to progress. I have a lot of company today.
Living with Frenchies.
Frenchies and my rescue boxer. Well, most of Frenchies too. So I have 3 Frenchies and 1 rescue boxer that are joining in on the podcast. And
they've actually been quite quiet. I'm kind of surprised. I have
a handyman on the property, and every time up in the yard, then they all think that it's the alarm just went off.
Yeah.
And, he's been here all day, and this is not his first day here either. So if they're not used to him by now, then I don't think it's even going to change. So, excuse me. Anyway, so I, understand that you have to have reasonable expectations. In treatment, it's going to take some time. It's not an experiment. Some people say, oh, well, you're experimenting with the remedies. And I want to give you a good idea. When I work a case up, or Dr. Pitcairn, or any of the other really wonderful homeopaths that you've come in contact with so far, when we're working a case up, we are taking the symptoms, often in very complicated cases that have layers of drugs and surgeries and everything on them as well. And we are trying to match a homeopathic medicine to stimulate healing in a curative direction. Whether they can be completely cured or not, I don't know. And so the client will sometimes say, well, I guess you're experimenting to see if that'll work. And I said, well, no, it's not really any different than choosing a particular antibiotic for a urinary tract infection, which homeopathy can treat, by the way, too. And it doesn't turn out to be the right antibiotic. No big deal. We have to go back and we have to choose a different or a better one, or do a culture of the urine. In this case, we don't have to do a culture of the urine with homeopathy, but we can say, well, what got better and what did not get better? Did nothing get better? If nothing got better, it's okay. I just didn't even get the ball even close to in the park.
Right.
Go back and look at the case again. And every time I meet with that client by phone or in person, then those appointments build upon each other. So we're not an hour and a half for each appointment. They build upon each other. I need to know what got better, what didn't get better, how much better did it get, to make an assessment at that point. Do I need to repeat the same homeopathic medicine? Do I need to wait longer? That medicine's still acting. And that could be weeks or months. Or days, or is it a remedy that's similar? And so maybe it created some positive effect. Is it so similar it aggravated the patient? Or was it totally amiss? And if it was totally amiss, I take any of that information to determine what do we do next. So it's a process of healing that's exciting because you can see the progress. Whereas in allopathic medicine, you might disappear a symptom for a little while, but it'll come back again. You can be pretty sure of that. Or even if it doesn't come back, the patient doesn't feel that much better. Like maybe they don't have diarrhea anymore, but they're not energetic and they're not playing with their toys.
Oh,
and that's not healing.
They don't put all of those symptoms together. They're when an animal is on some kind of a medication and it gets rid of one symptom, they think it worked, but then other things start to spark up, or, you start to see it.
Correct.
And it's like, that's because of the medication that your dog is now, his diarrhea stopped, but you're exactly right. Now he's lethargic. He's sitting in it, and that's not good. People People don't pay attention to that. And I think you're dead on when you say the homeopathic and the holistic veterinarian, a true holistic veterinarian, is held to a much higher standard. And people think that it's almost like people walk in and if they're not convinced before they walk in, but they're stressed by the other one, if they want to have that aha, I knew this wasn't going to work kind of moment and not allow the process to take place. But you're right. They'll allow a allopathic veterinarian to prescribe different antibiotic. I've seen it. And then go back to the same one that didn't work in the first place. And maybe it'll work this time. I have seen that happen so many times.
Exactly right.
It just, and each time the pet comes in, it's worse. It's not even as bad as it was the first time. Now it's worse and the symptoms are worse when they come back, especially when you're talking about ear infections. If you're okay with doing this, and before we do, I'm hoping you can take us through kind of a day in a life of somebody coming to you with we'll pick a disease. You could pick one. But before we get into that, I want to make sure our listeners know Dr. Cannizzaro is not giving you treatments for your pets that you're listening. If you're listening, she has to see your dog. She has to go through all of this. So if we do, kind of just to give you an idea of what it would be like if you came in with a dog who had a certain disease, please don't go home and try to find these things that she's mentioning without talking with her or a licensed veterinarian homeopath. I don't know if I said that strong enough. I just don't want I want to do this because this is where I wanted to go from Dr. Picarin's. I wanted to show what it would be like and what kind of homeopathic medication. Do you call it homeopathic medication?
I call it homeopathic medicines.
Okay.
So people call them remedies. I use those terms interchangeably.
Okay.
And so that is important what you said, because when you're treating an acute issue, a bee sting or something like that, unless you're deathly allergic, and that's another which still homeopathic medicine could help that, but you need
another level.
So don't try to just do this on your own. I mean, you really do need guidance. You wouldn't pick up a chainsaw and have no idea how to use it and just say, well, maybe I'll just experiment with it and see if I can figure it out.
So let's do this. Let's do, I'm trying to think of one of let's do my cat. So we'll do my cat, and she died already. So she has passed away. But so I'm going to use what was going on with her prior to, and so let's kind of show the listeners what it would be like if we were doing kind of a thing. But she has passed away, so you can't help her. I wish you could, though. I think she was 20 years old, and
that's wonderful.
Right, she was 20 years old. So but I to this day don't really know. We thought it was kidney failure. I brought her in her. So I would come to you, I would say, tell me how I would do this. What would happen if I was going to a homeopathic vet?
Well, when you're going to a homeopathic veterinarian, first of all, as I mentioned earlier, so I'm not going to belabor it, I do ask for all the handwritten doctor's notes, test results, etc., as far back as you had your baby for.
Okay.
I typically will go over those records with you in detail so I can fill in any gaps, because there can often be a lot of things missing in the records. And I do what's called a case taking. So what I do is ask what the primary complaint is, what your primary concern is about your cat. And we would go from there. I would ask you detailed questions about that.
Okay, so let's do it. We won't go too detailed.
Yeah.
But let's say
mock, and I'm not writing anything down. So what I would be doing is writing things down with the intake so that I can collect the data I need. And then I go into my homeopathic program, usually while you are here, to input the symptoms that I think are most impactful for the case at hand right now. Even if there's layers and stuff, I'm going to take the thing I think is the most important right now. Let's say your cat's not eating or something, and that's really critical. What it was. So I need to know everything there is to know about that. So we can do a little mock workup if you want now. Yeah. And I won't be able to come up with a homeopathic medicine because I'd have to access my homeopathic program or my books.
That's okay. Let's just do a little mock one so that people kind of know. So I'm going to come to you, or I'm going to call you and tell you that my cat is 20 years old and she hasn't been eating for the last 2 days.
Okay.
And that's unusual for her. She normally will eat every day. She's a good eater.
And have you seen the vet yet and had any diagnostic test or assessment for hydration?
We'll go there. So I took her on day 3. I took her into the veterinarian. We ran some tests. Her kidney levels were high. I can't remember what they were.
That's okay. Okay. And so when did you first notice that she wasn't eating?
The first day, because she's a big eater. So she went
So
from,
she ate totally normally, and then all of a sudden on this one day, she stopped eating altogether.
correct.
Now, what did that look like? Did she come into wherever she's normally fed to come for food while you were preparing it?
No.
And is that unusual for her?
So I don't feed her at a specific time, so she doesn't know what time I would be feeding her.
Okay.
So there wasn't a like
Okay.
she wouldn't know to come because my schedule's so hard at work that I just feed her when I get home and I feed her. But anytime I go to her bowl with food and I put it in, she jumps in, she goes right into eating.
Okay, so
So
you've always brought the bowl to her.
correct.
Okay, all right. So that is customary for you. And I say that because I want your listeners to know that some people will automatically say, well, I just bring the bowl, but it's not what you customarily would do. So that will tell me that that animal has an appetite disturbance, even if they will eat when you bring the bowl to them.
Yeah.
There's still an appetite disturbance because they didn't come to the feeding station as they ordinarily would. So in
Okay.
your case, that would not be an indication of an appetite disturbance because you always bring the bowl to her.
Always.
So she never has to get her princess self up or anything to come anywhere to come eat because you'll go accommodate her. So what
Correct.
happened when you put the bowl down?
She wouldn't even come to it. She had no interest at all.
Didn't look, didn't
Nope.
sniff,
Nope.
didn't take a lick,
Nothing.
didn't turn her head away.
That was when I first noticed she was lethargic because I thought, okay, yesterday you ate fine, came running when I put the food down, everything's fine. Today, so of course that made me start thinking she injured herself, like maybe she hurt something. And then I thought maybe the food was bad and maybe that was it. So I totally switched food. I tried, went through that path. She was walking normal. She would get up and walk, but I had to encourage it. So now I'm noticing I've got not eating, totally lethargic.
And I want to puzzle through that a little bit because I think it'll be helpful for your listeners.
Please.
Oftentimes it's common for clients to go through that whole litany. But what's interesting about that is that if the food was bad, she would probably get up and start to try to eat it and go, well, no, not this.
Sure.
And again, I don't expect you or your listeners to know that, but I'm going to know that already. Okay, well, that doesn't sound like that would be it. And I could be wrong. And then I don't remember some of the other things, but I wanted to pick on that anyway, because I thought that was, pretty noteworthy. Once we know that she is lethargic, slow walking, and not eating, the diagnostic tests are helpful because there could be a whole host of reasons for that. Probably not an injury because I think she'd favor a particular part of her body or something. And given her age, you would be worried about hyperthyroidism or kidney disease or something like that. I would probably ask you if she looked different or if her behavior was different in any way toward you or your family members. Because what I'm looking for is in homeopathic medicine, I'm going to tease out as I'm doing the workup, am I going to need more of an acute remedy or more of a chronic remedy? How do I know that? If there's an extensive change, particularly in the behavior of the individual, like not active anymore, but that could be due to dehydration. So I'm going to talk about that in a second. And, or let's say she ordinarily loves being picked up and held, and now she doesn't want to be bothered and doesn't want to be touched at all. That's going to be a different remedy than her chronic remedy. Does that make sense?
Yeah, it makes sense.
The chronic remedy that would match her is not likely to be the remedy. If everything about her is the same, she's just as affectionate, even though she's lethargic, loves to be petted, brushed, held, loved, kissed upon, or whatever, then she's probably still in her chronic state.
Okay.
One thing as a homeopath that's really important is that if I'm going to take sluggishness or lethargy as a symptom, I need to truly understand what that means. Since we can't talk to our patients like we can a person, if you were feeling sick and you were sluggish, you could be sluggish for a variety of reasons because your joints or your muscles ache all over. Or is it because you're feeling really weak and you can't move any faster? Is it because you're anemic? Is it because you're dehydrated? So if I'm working remotely with you, for example, I would want to better understand those things. Some we can understand better, some not. So getting the blood work done and knowing that her kidneys are a problem, the vet would probably say or notice on physical exam that your cat is also very dehydrated, and may or may not notice that your cat also has anemia because of the kidney disease. So then we have to figure out how much is the dehydration and how much is the anemia and how much is I feel so crappy from my blood urea nitrogen being so high, to understand her case a little bit better. How do we figure that out? She gets subcutaneous fluids or IV fluids. How much did she perk up? Is the lethargy gone now? If it's gone now, I'm going to use that lethargy in a very different way. It could be the toxicity of the BUN being really high. So I know I'm talking a little allopathically, but I think it's important.
Sure.
Or is it because you rehydrated her and she was so dehydrated she felt like crummy, right? If you rehydrate her and she's still sluggish, then maybe her joints or her muscles ache. I can't make that assumption, but I can use that sluggishness more because it's still present even after the hydration.
Okay.
Because if we assume, and I think it's a mistake that some of my homeopathic colleagues make, oh, I'm going to use sluggishness or headache, because probably they have a headache if their blood urea nitrogen is really high, but we can't ask our patients that, so we can't reliably use it. We need to rule out those factors so we truly understand what's happening in the case. Because if she feels poorly and she's fully hydrated, that's a different state than if she is fully hydrated and now she feels a lot better. She still has kidney disease and maybe she's still not eating. What if she eats after you hydrate her? Probably she didn't want to eat because she felt lousy from the BUN. So I'm going to need to find other symptoms to know how to treat her kidney disease better. Does that make sense?
Yeah, it makes sense. It was hard so we did hydrate her and it didn't have any effect at all on her. She still wouldn't.
Anemic?
No. So, it wasn't brought up to me and I don't know if I looked. It's been a while now, so I don't remember if I looked. That was not brought up at all if she was anemic. So I don't think.
Okay. It's an important prognostic. If a cat has kidney disease and they're anemic, the prognosis is not as good.
Yeah. I'm pretty sure she would have told me if she was anemic. I can't remember, but for the sake of this, let's just assume she was not anemic.
Well, just for the fun of it, for the listeners, because this will be interesting, and I'm not suggesting this is the remedy you need to rush out and go use for cats that have a kidney disease, because it's not the case. But let's say, for example, that you hydrated her and she felt much, much better. There's a homeopathic medicine, for example, that is called China officinalis, and that remedy is well known for diarrhea in particular, but it doesn't matter. We'll take that out of the situation right now. But one of the things that's really notable about that remedy is that loss of vital fluids makes the patient very ill, very, very ill. So as a differential or a choice of remedies, if I were working the case up, and again, I'm not at my books or in my computer program, I might consider China if you said, gosh, she got so much better after the fluid therapy, whether it was kidney disease or something else. And I might say, does China seem to fit, her cat's case? And there could be certainly many, many, many other remedies that could be helpful. So as far as the appetite, if it's unchanged, then I would take that symptom of the appetite being completely absent, even though you hydrated her and maybe her blood values look better. We'll just make that up for the sake of it. Then the appetite is really important because it has nothing to do with the hydration per se. It has to do with the state of sickness and a symptom that goes along with the kidney disease that she has. And I would be looking for other characteristic symptoms. So complete absence of appetite. I would ask you questions like, does she drool, or have you noticed any vomiting? How are her bowel movements? How's her urination? Is she thirsty? Does she not want any water? Does she go to the water bowl? And these are leading questions. So normally I'm not going to ask leading questions for the interest of time and your
Sure.
listening. I want you to get an idea of the detail that I would ask in a particular case, that I would ask openly, and you would keep talking to me and tell me these things without prompting. So right now I'm asking prompting questions. There are some cats that will sit over the water bowl, look like they want to drink, but then they just don't.
But they don't.
There's particular remedies for that with kidney disease, for example.
So what I'm going to advise our listeners to do, just from somebody who went through this, and of course it's just as traumatic for me to lose a pet as it is for anybody, going back and now knowing that I will be having all of my pets seen by a homeopathic veterinarian, I would keep a journal and write this stuff down, because, there was probably things that I didn't think from a homeopathic standpoint that I should have been paying attention to that were symptoms. I was trained as an allopathic veterinary technician. So I'm looking for eating, drinking, whether they're lethargic or not. Drooling, of course, that was something I thought, was there something that she could have gotten into? Is there something that, of course I thought like that, but there's so many other symptoms that a homeopathic veterinarian needs to know.
Characteristics of it, like if she's lethargic, if she gets up, if you had to help her get up, does she get better as she continues to walk, or does she get worse as she continues to walk? Is she seeking warm, cold? Do you notice then, does she want to lay under a fan or in front of a air conditioning unit? Or these kinds of details can help to, what we're doing is we're narrowing down the characteristics of all of the symptoms in that particular patient, because I'm not necessarily going to use a homeopathic medicine that seeks cold if she is burrowing under blankets and seeking warm and wanting to lay on a heating pad. I don't want to use a seeking cold remedy necessarily, because that wouldn't make sense. I want to use a remedy that's going to be seeking warmth, or prefers to be covered, or wants to be cuddled, or will eat only if you pet her, or will eat only, liquidy foods, or will eat only foods that have chunks. So when maybe you get her to eat or something, what makes the symptoms that you're concerned with better or worse? That's really important to us, because those little generalities, which we call generalities or peculiar symptoms, are very helpful to help us gain a picture. It's almost like, doing a puzzle. The more pieces you get to stick into the puzzle, the better that, thank you, Pebbles, the better the image is. And
he's all, I like puzzles.
Pebbles like, yeah, I don't have kidney disease. I'm not lethargic.
Did you say puzzles?
He's like, I like puzzles. So that gives us a better picture. And I encourage journaling. And Dr. Christina Shambro has actually a really lovely journal that you can buy. It's not expensive. And it's formatted really nicely.
What is it called?
It's Dr. Christina Shambro. Oh God, I hope I don't butcher her name.
That's okay.
CHAMBREEAU, I think. Okay,
we'll look it up. We'll put that in the show notes for our listeners so they can find it. Because I'm going to tell you, I think a journal, if we're going to work with homeopathic veterinarians, as not being trained and not even knowing what the symptoms that could possibly mean something, we're going to have to start journaling, because I don't see how a homeopathic veterinarian could work with a patient who doesn't speak or communicate in language, if the owner doesn't also understand what she's looking for. So,
well, if you go to my website, my wonderful web person was nice enough to put up 2 pieces of information. Both of them were written by Dr. Richard Pitcairn, and with permission, he has allowed us to pass those out to clients. So I wanted to put them on my website because I think they're incredibly helpful. One is homeopathic medicine, and it's a 1-page thing, homeopathic medicine and how it works. And the other one is a collection of symptoms that most veterinarians consider are totally normal, but they're not. And they should command seeking out a homeopathic veterinarian. And most of the time, those symptoms, not all the time, are in the functional range. And I want to define that functional symptoms are symptoms in the absence of any significant pathology. Structural disease is where the disease process has moved from the functional stage, where there was no measurable pathology, to now pathology. And understand that if we can catch these animals in the functional stage before they reach any pathological changes, the better, the easier, the quicker, the smoother, the more curable the patient is. So that's important to know. So a lot of those list of symptoms that are on my website, credit to Dr. Pitcairn, are good things for your listeners to go look at and say, oh my gosh, my cat does that. Or, oh my gosh, I had no idea a cat shouldn't throw up hairballs, every week, and should only drink water if they're on a proper, home, whole food, should only drink water maybe, once or twice a week at the most.
Yeah.
And that, I had no idea my cat drinks a lot of water every single day. Well, that's a symptom.
I know.
And or, I didn't know throwing up hairballs frequently was a symptom. Yeah, it's a symptom. So, or excessively waxy ears, or unusual odors, or, brown discharge at the base of the nails in the pets. I mean, they're not all of them are particularly serious symptoms, but they are the red flags that you could seize onto now, whereby you could work with a homeopathic veterinarian and at least get a well care program in place, even if there aren't enough symptoms to treat homeopathically just yet. Why wait too long? Let's get on a wellness program.
I agree. We do so much grooming, and the crusty stuff around the nails, I could just take it with my fingers and just scrape it off. And I try so hard to tell my clients that is a symptom. That is not normal. If you walked around with black gunky stuff coming off of your nails, I bet you $1 million you would go want to find out what the heck is going on with your body.
Well, if you were throwing up food several times a month, I'm positive that you wouldn't.
Absolutely. Absolutely.
And for a veterinarian to say, oh, cats do that. I don't worry about that. Cats do that. No, they don't.
No, they don't.
Can you imagine a cat in the wild getting chased by something? Oh, excuse me, I have to stop for a minute and throw up. Snatched up by the eagle or whatever it is. And, give me a break. Of course, that's not what happened.
Allopathic vets like to do that a lot. Well, they just do that. They just do that. No, they don't.
And honestly, the reason
my dog doesn't do that.
My belief is for the reason why they do this, and because I was an allopathic vet once, an allopathic only vet at one time, I believe that they do that because they don't know what to do about it.
Absolutely.
And when they don't know what to do about something, and the animal is still walking around and looking kind of healthy and vital, they're like, don't worry about that, because otherwise they have to say, well, I don't have the answer. Workup. And the client stands there, and no offense to vets, it's not always their fault. And the client's like, well, my cat is fine. My cat's acting normal. Why should I do a full blood workup? Yeah. And a lot of times the blood workup is going to be normal because maybe they have early stage inflammatory bowel disease. It's not going to show up on the blood work. So we could do a lot to improve diet. I wish the allopathic veterinarians would do that. A lot of their patients would get better if they would do a whole food, real food diet, nothing out of a bag, nothing out of a can. And if they would just do that, it's amazing how much would clear up.
Amazing.
But that said, not everything's going to clear up with diet. So sure, homeopathic veterinarian.
So I had this quick story, and I know we've taken up a lot of your time, but it is very interesting to me. I had a cat that comes to me for grooming quite often. I don't usually write down a whole lot of stuff about them. I mean, I'll write basically they're aggressive, I'm going to get killed next time I groom her, or they're good, but I don't write details. This particular cat was so good when I groomed her the first 3 times that I groomed her that I wrote smiley faces. She's the greatest cat I've ever worked on. Thank God. I walked out, she purred through the whole thing. She brought her in one time for grooming, and we couldn't even touch her. We couldn't get her out of the kennel. We couldn't do anything. And so I called the mom and I said, no, something's wrong. This is not your cat's normal behavior. And she had mentioned that they just moved and there was some stuff going on. I can't remember all the details, but it did occur to me that possibly that was part of the problem. So we rebooked her for a week later. And I said, but if this same behavior happens in a week, she needs to get into a veterinarian because this isn't normal. She said she was eating normal. She was drinking normal. She was acting normal in the house. Everything seemed normal. So she brings her back a week later and same behavior. Can't get her out. I said, please, I don't know what's wrong with your cat, but there's something wrong. So I didn't hear from her for a while. She just called over I think it was a week ago, and spoke with Whitney, who's one of my fabulous managers over there, and told her, I cannot remember what the cat was diagnosed with, but it is serious. But there were no outward symptoms that normally someone would pay attention to. Right. So I just love that we're having this conversation about understanding, they can't communicate. They don't have ways to communicate like we do. They can't write it down. They can't say these things. And unfortunately, by the time we recognize the symptoms, it's like you said, there's so many levels to it. So one thing she did say, and it just made me feel really good, is that the cat's going to be okay. But if it had gone further, I have to ask Whitney more of the details. But I think, we've taken up so much of your time. And I think one of the things,
you're an invaluable groomer, because I know a lot of groomers will bring stuff up, but to bring something like that up and not just say, gosh, your cat's just turned into a nightmare and I just can't do your cat anymore. For you to really notice, well, this is such a big difference. And I want your listeners to know that any mental and emotional changes in your cat, whether you moved or you went through a divorce or whatever the case be, those are significant, and those are symptoms also. So a lot of people think, well, it's got to be a physical symptom. Yeah. No, not necessarily. It could be a mental or emotional symptom, and it's still very treatable homeopathically. Now, that's good. If there's a mental and emotional disturbance, such as what you experienced with this cat, it doesn't mean that I might not advise a good workup to just make sure there's nothing internally the matter with the cat. In this case, there appeared to be. Yeah. And then the client can decide whether or not they want to treat homeopathically, allopathically, whatever they choose to do.
Right.
So that's an important thing. And I want to say, I worked at an emergency clinic, and it was a really terrific experience. And the emergency clinic owner, who is now retired, is still a good friend of mine. And God bless her. When I worked at the emergency clinic, I had started doing homeopathy, and I asked her, look, I've got some cases sometimes I don't really feel comfortable giving medication to, but would you mind if I gave a homeopathic medicine if it appears to be indicated and the client is okay with it? And she said, as long as you practice good medicine, I don't care. And the technicians got to see me do some really pretty amazing stuff. And it's not me, it's just how the homeopathic medicines work. But on the side, I used to do some surgeries, because a lot of the techs had really big hearts and they do a lot of rescue work. And I would spay and neuter these kittens if we were slow. And one of them arrested at the end of the spay and started blood coming out the nose and mouth. And, the tech was really sweet about everything. And she's like, no, it's okay. She wasn't a really well kitty. And you told me it was a risk doing the surgery, but I needed to get the surgery done. And, I let her go. And I said, no, I can't do that. So I gave a homeopathic medicine, belladonna. The bleeding stopped and she woke up and she fully recovered. Wow. And the technician was and I don't mean in 5 seconds, but she woke up really quickly. And then, and when progressively went on to recover, and she was able to rehome her. And I said, well, let me just say this. I said, I would recommend, if someone's not pursuing homeopathic treatment from now on forever with the kitten, just caution them, might not be such a good idea to anesthetize this kitty, because there may be something with anesthesia that's just not going to go well for this kitty. Yeah. But the kitty made a full recovery and went to a new home, apparently. And I had a blocked cat, a client cat. This wasn't a rescue. And the cat was so fractious. I was trying to get x-rays to check for bladder stones, and, nobody could touch the cat. And it was just really tough. And so I just took a homeopathic remedy, Nux vomica, which is really good for this kind of problem anyway, the cat being so fractious. And I couldn't get near the cat, but when the cat hissed at me, I just dumped the pellets into the mouth. And the cat got so docile after that. We were able to take the x-rays, do some blood work, and unblock. Well, of course, we had to anesthetize him to unblock him. But so we went ahead and were able to do that. But I didn't really want to anesthetize him before getting any blood work, because they're in danger of having, really big, with the blockage, having big kidney disease damage. So, I was really worried about that. Yeah. So, and the technicians were standing there going, what the heck were those pellets? And these are chronic cases we're talking about too, even with the kitten. And yet homeopathy could work that fast. Now, that didn't fix that cat's problem ultimately.
Sure.
It unblocked the cat. And that chronic disease problem should be treated with homeopathy after the cat is unblocked, or before, during, and after, so that we can prevent blockage from occurring in the future. And that can happen with homeopathic medicine and proper diet. So just so your listeners can know, I mean, it was fun to be able to do that. It was fun to watch the technicians just go, I've never seen anything like that before. And, and it can make that much of a difference, because this cat was in so much pain and wasn't ordinarily a fractious cat. Fractious meaning that, just like the cat you were trying to groom was going to eat you alive. And so was he. He was painful. He didn't want to be touched. So he had moved into an acute flare-up of his chronic disease, being blocked, and with the behavior change. The client's like, no, he's a pussycat at home. No, he's fine. He's such a good kitty at home.
Yeah,
totally different cat. So, and then of course, when he did go on and recover, thank heavens. But so, there's so much we can do, and that is not treating to cure yet, but that is a start. And you could do that in emergency medicine. I treated a cat that got hit by not one, but 2 cars on New Year's Eve about 15 years ago. And the cat was unconscious, bleeding from nose, mouth, ears, every orifice. And I thought, oh dear. So I picked her up out of the road, dodging traffic, because we're crazy veterinarians and animal lovers, right? And so I picked this beautiful calico cat up, and I bring her into the parking lot, which was the nearest stopping place there on the sidewalk outside of a bar. And it was definitely after midnight. And so the people had quite a few cocktails. And all I had on me was I had a homeopathic medicine bag in the back of my car. And so I got that out, gave her a few pellets of arnica, which is a really big remedy for trauma. And I think I only had a 200C, which is a moderately high. It's a fairly high potency. But in a case like this, I might have used even a stronger potency, but I didn't have it. And I gave her the pellets a couple of times by mouth. And I asked them, could they get me a box, because she was bloody. And I wanted to put her in a box and, bring her home and doctor her up and see if I could find her person. And I'll be darned. I mean, they came out and, with a box, and she woke up, and this is just a matter of like minutes. She woke up,
wow,
kind of shook her head a little bit, and then she jumped up on her feet and ran away and ran under a car, and I couldn't get her again.
Right.
And I want to tell you, those people in the bar, their jaws were dropped, because they saw her unconscious and unresponsive, and they were like, what were those little white things you gave her?
Yeah.
And I said, oh, well, it's a homeopathic medicine. A what? And they're like, what was that? She was unresponsive.
Wow.
Even when I did emergency medicine and I would use steroids and fluids, and
you can't get that.
I never had recoveries like that. Never.
I've never seen anything like that.
Okay. Never seen it.
Yeah.
Her pupils weren't responsive. She was completely, I thought, I don't even know if she's going to recover, but I'll try.
Right.
See what I can do for her, right? And give her some arnica immediately. Arnica is indicated for brain swelling and for any kind of trauma. So was that the right remedy? Absolutely.
Yeah. Obviously.
I want to tell these stories before we're ready to wrap up, because we've talked a lot about homeopathic medicine. What does it look like in action? Obviously, the chronic cases are slower. But still people are excited and thrilled about the results they get. Can I cure every case and every person's animal? Of course I can. If I can relieve suffering and improve health in one animal, even if they're not curable, it's been worth it, because there is nothing, and I mean nothing, in allopathic medicine that I did when I was only doing allopathic medicine that created a reduction in suffering in the way that I've been able to do using homeopathic medicine and some nutraceuticals and good diet, etc. So I thank you for taking this topic on. We need to bring this out to the public. People need to know that there are alternatives to allopathic medicine, whether it's human medicine or veterinary medicine. And yes, there are human homeopaths too.
Yeah, I will take this on some more and have you come back if you're willing. We'll do a live Q&A like we did with Dr. McCarran after people have a chance to listen to this.
Absolutely.
Awesome. So you guys will want to stay tuned for that in case you have any specific questions like I did with my cat. Maybe we can help out a little bit, but I just want to be a big part of bringing this. I don't want to say bringing it to people's attention. I want to say bringing it back to people's attention, because it's been around for so many years. And I think that was the biggest thing when I started learning about it is to realize how long we've been using it, or it has been around. And it makes sense to me why the pharmaceutical companies and the veterinarian schools would want to push that aside, because money speaks volumes. And unfortunately we need to look.
Who funds research? I mean, pharmaceutical companies fund research. And when I was in veterinary school, we got free bags of science diet.
I know.
I mean, I didn't know any better. I was so excited that look, I get this free. I thought it was good food. They told me it was, and we had 3 weeks of nutrition in veterinary school, and it was taught by Purina and Hill's Science Diet. That's
People are shocked to hear that. I've told the story many times. As a vet tech, they would come in and buy us pizza and tell us why it was so good. And I was at one point, I think it was 18 years
tell
old.
Us how good soy was. Oh, it's better than meat protein. I'm not kidding.
Oh yeah, I heard the same story.
Pizza lunch right next to you, and enjoy the food and the little pens they'd give us, and I mean, the human industry, they get to go to Hawaii. We get a stupid pen.
I got pizza and a pen.
Yeah,
to sell my soul, to sell out all these animals. I got pizza and a pen, and I sold out animals for it because I didn't know any better.
Show of how good soy is, and that it's a better protein source than meat. And I'm not saying you can't go vegetarian, because I do indeed believe, but trust me, when Hill's Science Diet is talking about soy and corn, they are not talking about organic soy and corn.
Oh no.
I assure you. So it is loaded GMO with preservatives and all the rest of the stuff. And even literally cancer-causing preservatives. And I bought it hook, line, and sinker. And,
Me too.
Science Diet, the way to go. Yes, I didn't know.
Yeah,
and
I didn't know either.
That as the authority and the professional, I just took their word for it.
Yeah.
Same of the flea and tick poisons. Oh, they're safe. And I finally, when I started to turn a few brain cells on for a change, I said, well, how do you know? Well, because we did a study. And then you go look at the studies, and it was a study of like 16 dogs for like 3 weeks.
That's what it is. That's what almost all the studies on the drugs are on dogs. I just got done telling a client the other day, this is a whole nother
it's safe?
topic. Well, this is what is so bothersome, is that when you look at some of the drugs all of the drugs that are out there for dogs, they're testing them on your dogs. Those studies that they're doing are not long enough to teach anybody anything. So, and they wouldn't allow that to happen on humans, but on animals.
Like the ProHeart injection, and I'm sorry, I don't mean to pick on everything. All the drugs are equal in my brain world as far as potential danger, including vaccinations. And, ProHeart, it was a huge experiment on your dogs, and they took it off the market because it was causing too much death.
Yeah.
And then somehow magically, I can't imagine it had anything to do with the money of the pharmaceutical company, they were able to get it back on the market again somehow. To my knowledge, I don't think that the formula has changed. And they send this nice letter out to us veterinarians. I still receive those, that, well, we're reintroducing this because, we have found that it really is safe. And, kind of a garbage letter like that, like no information, like we did this to improve the product.
Yeah, nothing. We found it safe.
But we found it safe.
We found it safe.
Outweigh the risks. And so it's going back on the market again. Not a word to clients. So it goes back on the market again. Yeah. And I just have to tell you, I don't know. I just don't. Where can you get away with that except with the pharmaceutical company? If I sold you a natural product that killed your pet, and then I said, well, the risk outweighs the benefit, the benefit outweighs the risk. Excuse me, I said that wrong. So don't worry about it.
Yeah.
Would you be all right with that?
And that's only one dog.
Zero. No, that's all right. It's just one dog,
it's just one dog.
Maybe 10
that's what they do. I know.
10 out of 1,000 or 10 out of 10,000 will die from it. We don't think that's so serious. So
the thing that gets me the angriest is the amount of time they do the studies, and that's a whole. That's an actual podcast
very, very, very short. And when I was in research, our N equal N is your data pool, your number of individuals.
Right.
When I was working in research, we did thousands of studies on rats, and the studies took months and months. And then we'd come to some preliminary conclusion and decide if it was worth going forward to do more studies. I mean, I'm very sorry I did studies on animals, but that was the job I had. And
Sure.
I feel grateful for the learning experience because it was a very unique learning experience. But I bless all the animals whose lives were taken for, I think we can do it better ways. But anyway, the important thing is that we spend a lot of time doing that for drugs for people. And even drugs for people really aren't studied well enough, long enough. And our double-blind studies are, they are definitely fraught with problems. And that's a podcast we can have sometime if you're interested.
I am.
So
I think we should do one. We should.
Careful.
We'll do one on the studies, because so many times people want to say, you know, if you use Cytopoint, for example, well, they've done studies, and I will always, have you read those studies? Just because a study was done does not mean that you would not give that to your child based on those studies. I guarantee it, you wouldn't.
Well, not only that, but I mean, even with Apoquil, they're now admitting that it does have the propensity to cause cancer. Finally,
Yeah,
but
finally,
4 dogs were the study guinea pigs for it. That's
Yeah.
how they know.
I know.
That's how we know. That's how I know that it causes cancer. Cytopoint does too, and so does Atopica. Any of your immunosuppressive drugs do. But that's how we know, because we've been experimenting on your dogs as veterinarians, and we as veterinarians, sad to say, have been complicit in taking the pharmaceutical medications and prescribing them to your animals. And I think it's unconscionable when a veterinarian defends the product when your pet gets cancer.
Yeah.
Oh no, it wasn't from that. Well, how do you know? If I'm a veterinarian, if there's a cause and effect, and they are in proximity to one another, and there was no evidence of cancer before, now my dog's been on Apoquil for X amount of time, and now my dog has cancer, I think that is a strong suggestion there's a correlation.
Absolutely.
Was it the straw that broke the camel's back? Maybe. Or was it the absolute cause? It could be. We don't know for sure, but what I do know for sure is that drug helped to produce that cancer.
Yeah,
I know
I agree.
that's a fact, and every veterinarian should know that. And we can't stand idly by and defend these drugs, because I promise you the pharmaceutical companies are not going to stand behind the veterinarian. They're going to cover their own butts, period, and say, hey, we sold our medication, but it's the veterinarian's discretion to use it.
Yeah.
I mean, this is what they do, and they throw the veterinarian under the bus. So we need to get smarter as veterinarians. We just do. And not do the bidding of the experimentation of the drug companies. Same is true in human medicine, even with the vaccine or any other, very short-lived, tested experimental medication.
Yeah.
It's important.
Well, we have taken up so much of your time, and it's valuable time. She's saving puppies' lives, right? Like, I always think about that. God, you get to say that you save animals' lives. I saved a kitten a couple of weeks ago, and that was a good feeling. But you do it every day, and so I just thank you for
not as often. I want to save them all. I like 100% of them, and we don't get to do that. And I'm going to say, it's important for us to learn and continue to learn, to stay open-minded, and to be able to help educate. It's a pleasure to do this, because my mission in life is I want to empower people to be able to make decisions themselves about the choices for their animals and for themselves. And when they're able to do that, if you decide, don't think homeopathy's for me, at least you looked at it and you said, okay,
agree.
That is out there.
At least you looked at it.
Continue to do allopathic medicine, you'll get the same results. But you have a right to that. Everybody has a right to choose. But if you're not aware of homeopathy, how could you even choose it? Because the veterinarians, my colleagues, are not necessarily telling you about it.
Right.
And I don't expect them to explain, detailed of what homeopathy is and the history of homeopathy.
Sure.
We can do those kinds of things. But if I can refer to a special internal medicine specialist, then any allopathic veterinarian can refer to a homeopathic veterinarian. And we should be able to coexist together and be kind to one another, and to be able to coexist, because we should be here for the client, for you, the listeners, and for your pets. We're not here to stroke our egos. And I don't cure the animals. I am directing toward the best healing that is possible. And every day that an animal does better and is happier, healthier, more energetic, playing with their toys again, going for the long walks they always did prior to all the layers of medication or their original disease, every day that happens, it just makes me feel so much better. And that's why I sleep better at night than I did as an allopathic veterinarian. because I am doing no harm. I may
Yeah.
not be able to save everybody, but I am doing no harm. And
I
that's
love that. See why I
wonderful.
love her? See why I love her? That's
I love
exactly
you
it.
too, Carrie.
You're doing no harm. And that's the, I mean, I didn't have to take an oath, but it's still something that I promise people when they bring their animals to me to do no harm. And, and I reach out to veterinarians like yourself and Dr. Picarin and Dr. Dim. I mean, the list goes on, Dr. Judy Morgan. I mean, we've had so many fabulous, fabulous, fabulous vets on here. Dr. Joe, there's just so many. I want to name them all, which I don't, but because we don't have time. But I brought you all together because I want to do no harm to the pets that I take care of and to the people that follow me and listen to me. And I struggled a lot because I am not a veterinarian. And so a lot of times I would give advice to people in my area, and then their allopathic veterinarian would say, I'm just a crazy, stupid groomer, and that they should be feeding kibble and giving them flea and tick and medication and stuff. And so when I thank you for the listeners, but I thank you from a personal level too, because it's helped me in my path to teach people. I see these animals every day. It is so hard to see them suffer, and my words just get thrown away because I'm not a veterinarian. So I just appreciate you so much. And I love when you say you can sleep at night because you do no harm. And I don't think a lot of veterinarians realize that a lot of what they're doing is causing harm. And so this podcast, I hope, will not only speak to our pet parent clients out there, but hopefully to some of the veterinarians that might be listening to us that are considering. So do you know, is there any real quick, because we are going to let you go, but real quick, I wanted you to tell us although it'll all be in the show notes, but really quick, tell us your, how people can reach you. And if there's any books that you might recommend for somebody who wants to learn about homeopathy.
Sure, absolutely. And I can be reached either through my website, which is holisticvetcare.com, and that's spelled with a W in the front. Or you're welcome to call my office directly at 352-796-2648.
Perfect.
As far as book references, I really, really like Dr. Michael Dooley's book. He is an MD, and you can find his book on Amazon, and it's called Beyond Flat Earth Medicine. And
Perfect.
even though he's a human homeopath, it's a well-written book that anyone can read. It's not too technical. It has excellent information. The other books that I recommend and often recommend on my website are Dr. Pitcairn's book, Natural Health for Dogs and Cats, and also Dr. Don Hamilton's book. And forgive me, I'm probably going to forget the title on that, but easy to find. He's written one wonderful book. Those books are invaluable resources as well. I also encourage you to not only visit my website, but also visit Dr. Pitcairn's website. He does have a list of veterinarians who have been homeopathically treated, not homeopathically treated, but who are veterinary homeopaths. Hopefully we're all I included. And so sorry about that. And then also the Academy of Veterinary Homeopathy is another good resource to try to find a veterinary homeopath. Please understand that you may have to find a homeopath that is not in your immediate area.
Right.
There really is, unfortunately, not enough of us in the United States. And some of us will accept phone consultations. I am one of them that does accept phone consultations. And we already discussed what I look for and what I want, et cetera. But go visit these websites, empower yourselves, read Beyond Flat Earth Medicine, get Dr. Pitcairn's book, Dr. Hamilton's book. None of these are expensive books. I think they'll change your life. At least it will give you another way to look at things and another perspective on health and healing. And you'll feel empowered to be able to make some different decisions.
Thank you.
You can also visit the National Center for Homeopathy. That is a human group that has some resources. I don't know how good the homeopathic recommendations are for homeopaths on there. I can't say, but it's an excellent resource, and support these organizations because they're here for you. They're here to help you find better choices for yourself. So awesome. Enjoy and go investigate and have a good time on the internet.
Awesome. Thank you so much.
Thank
to all
you.
our listeners, thank you so much for tuning in and listening. I hope that you find all of this information valuable and you'll go out there and just, keep your pets as healthy as you can, set them up for success. Reach out to Dr. Cannizzaro if you have any questions or you want to do a consultation. I highly recommend it. So I'm going to sign off, and I will see you later. Thank you so much, Dr. Cannizzaro. I can't thank you enough.
So much. Thank you. You're amazing. And thank you, listeners, for hanging in there with us.
Yeah.
Come for the Q&A and bring your questions.
Okay. We'll announce the Q&A soon. Thank you.
Yeah. Thank
Bye-bye.
you, Carrie. Bye-bye.